Experimented with myself, looking at eating food, drinking water in not so hygienic conditions, where people stick their fingers in the glass and you know that it's coming out of just a container out in the open, and there could be problems. As most of you would know, gastro is a very common problem in India, and it's mainly because of poor hygiene is what we relate it to. So I decided to plunge myself into that, only to find, because I was taking Shivambu regularly, which is once a day in the morning, that it did not affect me negatively. All it did was I just cleaned my bowel out next day in one big flash, and that was it. It never left any lingering long-term negative impact on the body in any way, as in vomiting or getting a headache or tummy feeling funny or sweaty or getting the runs. None of the gastro problems, and that has persisted now for the past 20 years, that I don't have the problem. I can go to India anytime, just eat or drink wherever I like, and I'm reasonably okay. So far so good, touch wood. Now, experiments like this were conducted by me at different times. Similarly, when I started looking at using Shivambu for external use, and I started aging urine, and the books specifically say that you must concentrate the urine at least to 1/3 by boiling, or age it for 3 months before it is useful for therapeutic purposes. Having read that, I still decided to experiment, and initially tried a 6 or 8 week old urine, and was surprised to find that it had a specific cleansing feeling on the skin. At the end of a Shivambu shower, which is basically applying urine to the body, rubbing it in and waiting for about half an hour to let it soak in, and then having a shower with water, no soap, it was surprising how clean the skin felt. It just made you suddenly aware that all this time I've been having a shower with soap, without soap, and you don't feel as clean at the skin level. And it's only after experiencing that that you realize that there is a quantum difference in the benefit to the skin. These days, if I was to shower like that once every month, you can feel the benefits for the next few days as to how clean your skin feels. And then for a month afterwards, you think, oh, you're normal, till you have that shower again or a cleanse, and then realize the difference. So I think it's a relative thing that you can't really explain. Having done that, then I started experimenting with urine that was fresh. It didn't do anything. Urine that was maybe 3-4 weeks old. And slowly I've come to realize that what the literature talks about, 12-week-old urine, is the minimum for good therapeutic intervention. When I say therapeutic, I'm looking at skin conditions, any sort of scalp problems, any sort of beneficial results that you might want to harness by using it, rather than just using it and saying it didn't help. So that's where I am at the moment with that. When we say we need to store urine, we generally collect it in a big glass bottle. Glass is always preferred rather than plastic. And you store it in a cool, dry place. So you don't necessarily need to go into a fridge or something like that. You just leave it in a cupboard away from light. Just cap it. It doesn't have to be a tight cap. And let it age. And normally most of the urine that the book says is about 12 weeks old minimum. And I've now come to accept the fact that 12 weeks is the minimum cutoff point to get some therapeutic benefit. When I say therapeutic benefit, I'm talking about if you were to use it for some skin conditions, or if you were to use it for improving your skin texture, or for a normal person just to use it to feel a cleaner skin, then you need that sort of age urine to get that benefit. Older is better. But be careful. As it gets beyond 6 months, it becomes so concentrated that depending on who you're using it, you have to be extra careful, especially with kids, women, or people with delicate skin. They might get burns or they might get a rash. So you need to be very careful. And it's not advisable to dilute it and use it either. It's better to have the right level of concentration and use it at that level. Now, something that's interesting that I've noticed since I've been storing urine over time is when you're quite healthy, the urine that you collect and keep it for storage in the next few weeks does not grow any fungus or mold. But for a lot of people, and I haven't identified whether it's the food or whether it's the health status, but what has become obvious is you ask people to store, they store it, and after about a few weeks when they open the bottle, they got beautiful mold settling on the top of it. Now that is a clear sign that the body has got some form of disease state at a very low grade level, which when you leave the urine out there, it's picking up and growing. I know allopathic medicine would like to say that, oh yeah, anybody's urine, you leave it out there, it'll grow. I know it'll grow, but I know my urine doesn't anymore. And I've got urine at least about up to a year old. So there's a definite change in people's health, and that can be reflected in this. If anybody is going to use urine for external purposes and they find that they are growing mold, please disregard it, chuck it out. It is not advisable to use that. You need to go back and look at what to do. Earlier we were discussing some things, and there was the question of when we drink urine, what is a good prescription? Generally the books say you should drink only the middle 1/3. You should pass and discard the first 1/3, collect the middle 1/3 and discard the last 1/3. In my experience, what I've noticed is drinking the whole urine is much more potent. So I generally prescribe everybody to drink the whole lot of their urine, and I have suggested a benchmark which is considered early morning urine.
Just a big gust of wind there.
Yeah, I know. I could sense it, but I wasn't sure. I generally recommend that you should drink all the urine that is passed at that point in time. And it's generally recommended that the minimum one should drink is the early morning urine. And I had a hard time figuring out what would be a good time to say early morning urine, especially for people who might be getting up in the middle of the night or somebody who wakes up at 4 in the morning. So I've drawn an arbitrary line and decided that for my purpose, and I've found it very useful, and others can decide what they feel is right, 3 a.m. is the cutoff point that I've drawn. Anybody who gets up at 2 or 2:30 and happens to pass urine, they don't need to drink it. That's not early morning. And anything after 3 o'clock is considered early morning urine. So when you go out there and collect that, drink the whole lot of it if you can. The only people I strongly recommend not to drink the whole lot of urine or not to take at all are if we have had sexual intercourse and there is likely to be semen or sexual fluid in your vaginal tract or in your penile tract, then you should forcibly pass your urine in the first part and excrete that and cleanse the tract and then drink the rest. That is quite okay. The second thing is women during their period cycle should not really drink urine. They should wait for 2 clear days after their periods and then go on to drink their urine. While we were talking about drinking urine, the question of should one drink aged urine? Now we know aged urine is potentially very powerful as it grows in time. So obviously 2-day-old or 2-week-old is not as strong as 12 or 24-week aged urine. What I have noticed when we have used aged urine for mouthwashes or eyes is it is very powerful, it's quite astringent, it can burn, but it doesn't seem to burn harmfully. I've used this as drops in the eyes and it seems to clear up. It does give you a red hot eye as if you have been drinking the previous night, but it does cleanse the eye a lot quicker. Interestingly, with the mouth, doing a mouthwash with aged urine, the tongue becomes quite crisp and clean, The teeth seem to feel good, the gums seem to feel good, but the skin or the mucus lining of the inside of the mouth seems to just rip apart, literally. And you find you got mucus lining all over your mouth in mouthfuls. For that reason, I do not recommend such strong urine to be considered for ingestion. Because if one was to drink that, if that's happening to the oral mucus lining, I'm sure it will have quite a strong effect on the whole gut. And it could be disadvantageous or actually cause a different problem. I haven't studied that part in depth, so I can't really comment on that, but these are my observations and my analysis.